I'm gonna record. Oh, there we go. Well, hi everyone. So welcome. I've been doing this Ask Dr. Anita on Instagram, and we are moving it to YouTube, but I guess I don't need to say that because you're going to be seeing this all the time. But if you happen to hit this one, this is our first one trying that out on YouTube. Hopefully it works. But anyway, so Ask Dr. Anita is where I provide you the bigger picture on healthy living through my unique perspective, Western, Eastern, and functional medicine perspective, and Liz, who works with me and is a massage therapist in the office, usually collects questions from the community, and we answer them. So what have you been hearing lately from people that wanted to know about what?
Well, Dr. Anita, this month apparently is World Mental Health and Depression Awareness Month. And October 10th was the International Mental Awareness Day. And I think it's kind of been on a lot of people's radars a little more this month, but definitely more so sort of in the last few years after a lot of people have experienced a lot of sort of mental health struggles over the last few years in particular. So today I had a few questions. Fortunately, there's more and more awareness about depression and mental health, but so sufferers do have better access and are able to get help and support rather than feeling isolated and alone. And as we know, depression can take many forms. What are the signs and symptoms of depression? How can it manifest physically, and when should we reach out for help?
So I think the reason why depression has been such a big topic now is because, because we just came out of the pandemic, or we could still be in the pandemic and still on people's minds, the isolations that we had, adjustment to changing changes, the way we live, the way we function. Some are good, some are bad. I think changes is always, it can be difficult, especially with teens who are going through puberty, going through bodily changes, and then going through this isolation and all of these. So typically, depressive episodes, or just when you have low moods and adverse to do an activity that can go away and after a short amount of time. And you can have relapsing depression, and that's usually when it occurs within the 6 months of when you had a depressive episode. And it can always be situational, life-changing, relationships, jobs, finances, things like that. Recurrent depression doesn't have to be limited to those, but recurrent depression then would be just signs of depression, more returns greater than after 6 months. And could be even after years, right? So recurrent. And then chronic depression would be depressive episodes that are lasting for 2 years. So you're just having it on, you're just chronically, depressed or low mood, don't really want to participate or do anything. So that would be, chronically fatigued. You can't sleep well. There's some sleep disturbances, whether you fall asleep or you sleep all day long or you wake up, but there's some sleep disturbances. Cognitive dysfunction, you can't concentrate, can't do your job, right? Feeling worthlessness, feeling of hopelessness, having irritability, being restless, feeling restless, loss of interest in your hobbies. Things are not giving you the joy that you had and the activities that you want. Change in your appetite changes. Persistent aches and pains, digestive issues, anxiety, sexual dysfunctions, thoughts of suicides. You don't have to have all of those, and there are probably more, but those are probably the signs and symptoms that most people generally can think of. So we want to be watchful on our adolescents, because they may not reach out to you or express anything or say anything. So you want to, especially, I don't know if you're going to ask this question, but I was just thinking about it, like who are more vulnerable. So if those teens are in isolation, The elderly are more prone. Females tend to be more people living alone, getting divorced, people with lower education, having functional disorders, just being physically ill, having alcohol and cigarette use, loss of purpose. So, and typically, sometimes you just may have a genetic predisposition towards it. So if you have a genetic predisposition and then you have an isolation or advanced age, it just maybe flip that on, right? So, medications and economic things. So also it's kind of goes along with the other symptoms. I mean, those were symptoms. These are more like maybe predispositions. I don't know what that is.
Yeah, no, that was definitely one of the questions. Especially as some people feel that they're afraid to sort of reach out for help or to show vulnerability, and definitely in those demographics that you mentioned, there's a lot of people who have been asking questions from all of those groups. So are there any, I know that exercise is known to boost endorphins and help maybe alleviate some of the symptoms of depression. Are there any sort of natural remedies, supplements, or foods that you would recommend that people could add to their diets just to sort of help when they're experiencing symptoms?
Yeah. So I just want to clarify. So some of the things that I had just said about maybe the causes. Like I said, you could have genetic, and then predisposition. If you have stress. So I'm going to just answer your question by doing an anti thing. So if you have that the causes of depression. So if you have a genetic basis, you can't change that. But if you have stress, and that may flip that on. So we want to reduce your stress. So anything you can do to reduce stress. So being with people, getting exercise, sleeping well, doing things. So traumatic experience can be a trigger, right? So we want to avoid trauma, right? Unresolved emotional problems. So we want to confront those, maybe cognitive therapy or talk with your friends or things like that. Medications, so you have to talk with your doctor. Having just medical conditions, cancers, heart attack, stroke, something, substance abuse. So you want to avoid getting addicted and having substance abuse. So, and lack of sunlight can cause depressive episodes. So one of the most natural things to do would be to get 30 minutes of good UV in the morning. So that's something I always tell people. If you get up in the morning, rush in your car, and you're in the dark, and then you go to the office, that's not going to work. You need to be outside for 30 minutes, be in the sunlight for 30 minutes, first thing in the morning, or get a light. So people in Alaska can't do it because it's dark. So you have to get the special light, so that if you feel kind of low, because they have seasonal affective disorder, so you actually use the light. So lack of sunlight, neurotransmitter imbalances. So we don't want them to be imbalanced. So how do they get imbalanced? They get imbalanced by not sleeping well, not eating well, your gut not being imbalanced, nutritionally deficient. So we want to make sure that things are balanced, because you don't want your neurotransmitters to go off balance. Hormone imbalance, so that could be andropause, perimenopause, just stress alone will elevate the cortisol, make your hypothalamus and pituitary and thyroid go off, which will make your reproductive hormones, all of that. So that nutritional deficiencies. So we don't want to be nutritionally deficient. So you want to eat a rainbow full of color, fruits and vegetables. So you need to eat those fruits and vegetables galore, because having a healthy gut really helps you with the depression, because the gut's connected to the brain. So, and your gut makes about 70% of the serotonin, the feel good neurotransmitter. So, and then I'll get into the specifics. And then avoiding toxicity, mold and metals, just, generally your diet, and not being hypoglycemic. So if you want me to then just to be specific on those things, so that's just general speaking, but like fish oil, right? So getting not a lot of omega-3s, because they're critical for neurotransmitters. So if you don't have enough omega-3, your neurotransmitter functions is not working that well. And then what happens? Then your brain is more emotional, not feeling well, psychologically, it's just not quite balanced. So fish oil is key. Vitamin D. So vitamin D is very important, because especially for those who don't get enough sunlight, they're going to have that SAD, that seasonal affective disorder, right? B complex. B6 is the feel good vitamin. So you need the B vitamins, because what do? They keep your neurotransmitters functioning well. So if you having neurotransmitters are off and your just mood's not right, you need your B12s, your B6, all of those, because you could be low on folate. So a lot of B vitamins, and that's, guess what? Vegetables, leafy greens. So you need your leafy greens. I can't say it enough. I love this. And adaptogens, herbs, which is good, like ashwagandha, rhodiola. Those are very helpful just to balance out the nervous system. And it can help depression, enhancing the brain functioning, lowering the cortisol, so lowering your stress. So that can help. So these are not nutritional, but these are more herbs. And St. John's wort is one, and some mushrooms and things. So, yeah.
Thank you so much. Yes, and thank you for clarifying the question before. Although we've had questions from all different ages and genders, statistically, depression is slightly more common in women than men. As well as, like, as you've mentioned, there are different, psychosocial factors, biological, and possibly hormonal factors can affect us. Can hormone testing or any other testing help determine or help us in any way?
Well, so with so because we want those balanced, but I think the testing would be, we can look at the hormones and look and see how your levels are and where they're going, and also testing the gut and seeing how the gut is functioning and how well that is, because you need to have a balanced gut microbiomes for, as I said, the serotonins and the brain, how it can feel good. So I think it's because men get old too, right? So the elderly are affected, the men are affected, and then when their levels of hormones, you just don't feel as well. So just supporting that and looking into if you have, some hidden pathogens, mold, things like that, and making sure the gut is balanced and absorbing the nutrients. So when they're not in balance, they don't absorb it, and that the mucosal lining is not healthy or not making your serotonin, things like that. So, sometimes, and I mentioned it before, with the, essential oils can also help, like, lavender, chamomile, some of those things, patchouli oil can help that. But yeah, so looking into the root cause and doing testing, I always think that's, whether we look at nutritional to see if you're getting them in, and then, so that's a blood test and saliva and urine, or we're looking at the gut, which is stool testing, to see if the gut is healthy enough to absorb them, and if it's healthy enough to do what it needs to do, making serotonin. And then just I check the urine, which is better than, I think, than the blood and the saliva at this point, because it's going to give me a little bit more information about the receipts and where the urine's going, where the hormones are going and how they've been. Sometimes we still have to get the blood level of it, but we can make a lot of estimations from the urine. So hormone testing and figuring all of that out. Yeah, so testing, I think, is very important for men and women.
Yes, absolutely. And of course, as you've mentioned, there are, it's very important to consult with your doctor or, a qualified therapist. But is there anything else you can recommend to help support mental well-being and mental health?
I think
broad
Yeah.
subject, very broad question, Catherine.
I think, well, I mean, I think we pretty much, I think covered it, but without being, specific. So, I mean, things would be, you want to make sure that you know, you eat well, right? So you eat vegetables and eat a healthy, balanced diet, that type of thing. So having rainbow full of colors, right? Exercising, right? So you want to just, you know, eat the, I don't know, what did I say? So the balance, so health, balanced diet, fruits and vegetables, healthy fats, right? Lean meats, so your grass-fed beef, that type of thing, organic meats, probiotic foods. You want to limit the refined carbohydrates and sugars. Um, get good, have support from your friends and spouse, so relationships or church or any group, exercise, and then just being outdoors, right? Because you're going to get the sunlight. So I think we've said it all in different ways, but you need to just and it's hard because when you're depressed, you're not motivated to do any of those things. But
Absolutely.
I think the biggest thing is if you can identify that you are depressed, is to reach out, because that's what people don't do, is just try to make that phone call, try to tell somebody, try to hang with somebody, make sure that they're aware, to get you to eat the right things, you know, do the right things, take their food, get the supplement, the nutrients, and eat well. So, but yeah, try. I think the number one thing is get your support group, get who can help you, and feel comfortable to let them know you're not feeling well, and that they can reach out. So I think that's the biggest message. So
Yeah.
thank you, Liz, for this topic. I know um, this is a big thing that's going on in October, including, it can tie in with, because it's also breast cancer month. So cancer and anyone dealing with that can also be dealing with the level of depression. So if you know of anyone going through health changes or anything, reach out to them and just check in and make sure they're okay. So, so thank you, Liz, and everyone watching. Till next time. Unless you have something else to say, I didn't mean to cut you off, Liz. No. Be safe. And Liz, thanks for collecting the questions and accumulating them, getting them from community. If you have any interest in contacting us and sending us your ideas of what you would like us to talk about here, please send it to us. You can, and remember, these are just for educational purposes with my unique perspective, and you should always consult your doctor making any diet or lifestyle changes. And then you can submit your questions to us via my website, anitawangmd.com, or call 949-734-0580 and leave a detailed message. And you can reach Liz also there. But I think, Liz, you have another way for people to reach out to you if they want a massage, because she does excellent cupping, craniosacral, helps you to relax, restore deep tissue. She's really good. She helped me recover from an injury from rock climbing. And so I know. So yes. So how do they reach out to you if they don't get you through my scheduling site?
You can find me on Instagram at Laguna Massage Therapy. So you can contact me via direct message on that page. And as in for this month, I'm actually going to be giving away a complimentary 60-minute massage to somebody who's been struggling with the things that we've mentioned today. So, if I would ask people if they want to either nominate somebody that they feel would benefit, or nominate themselves, then please contact me on that page.
Oh, excellent. Thank you. All right. Till next time, be safe, everyone. Take care.